I would like to go to Wayne first, if I could. Your team are responsible for designing and developing healthcare pathways. And we're starting to hear more about value-based healthcare. Could you share a little bit about Bupa's perspective on this and any examples where this can really benefit employers?
I mean, fundamentally, it's about realising good value for money in healthcare. That's something that Bupa has been very focused on for a long time. I'm thinking of things like our triage services, our best practice care pathways. So all of those things have been helping to realise the best possible outcomes for customers and also to manage claims inflation for employers. But we're at a next frontier or a new frontier now for value-based healthcare, and that's really around starting to link the healthcare improvement for individual customers, so clinical outcomes for customers, to the reimbursement that healthcare providers receive.
And Dan, when it comes to shaping Bupa's product strategy, what's your biggest priority to help employers manage and plan their health and cost risk?
For us, a big question is how do we do more with less? And how we've been talking about preventative health for a long time, but how do we really make it deliver value? And actually, when we look at our product portfolio, we're trying to do a couple of things. We're trying to simplify and actually really ask ourselves, do the things in the product at the moment, are they really adding value in the workplace? Are they really delivering good outcomes for the customer? But also, are they helping improve longer term outcomes for that employer in their workplace? So there's some things actually that we're taking out, or we're reviewing those.
Rebecca, so Bupa now offers 2 genomics products. These tests are improving outcomes and reducing claims. What's the evidence around that you could share?
It's kind of amazing that we have a healthcare system when 80% of our health outcomes are driven by factors outside traditional healthcare, right? Our environment, our lifestyle, our activity. Again, we all know that this is important, but actually it's driving poorer outcomes as a society. So genomics is absolutely essential because what it does is it provides that insights for us to be able to modify those risks earlier. It gives us a doorway into that 80%. Whether that's to support better health behaviours, whether it's to prevent disease from occurring or to diagnose it earlier, to be able to reduce long-term chronic health risk. All of these things are really important. I think specifically on the polygenic risk score, I think something that's really important is that 50% of actionable genetic risk, fundamentally people are asymptomatic with it, right? So 50% of people with actionable genetic risk have no symptoms. They are walking amongst us. And so uncovering that risk is really, really important.
Sarah, coming to you, can you share some examples of where you've seen genomics working effectively in a hospital environment?
So we've got about 650 outpatient appointments we're looking at and collecting all the data through the clinic letters that the consultants have produced. So all of those customers will have a risk of something, and the top conditions really fall into the categories of cardiology, dermatology, breast surgery and gastroenterology. So all of those patients pretty much will go on to have some further investigation under the care of that consultant. And the outcomes really they range from a very small minority, such as those customers who we found have got the BRCA gene, for example. Yeah. They'd had no family history, wouldn't have known about this had they not gone through whole genome sequencing. And they've been offered prophylactic surgery. That's a very small minority to prevent cancers that they would be susceptible to. Or it may be just a question that people at risk are given screens more frequently, so they might be recommended to have a colonoscopy every 2 years, well, otherwise they wouldn't have had that. Or they might be advised to have mammograms more frequently than they would ever be advised to on the NHS screening programme. So that we know those customers that are at risk, we're watching them, we're going to screen for them, we're going to pick up their disease earlier and change their future.